And we've really tried to distill the fundamentals of what's needed from an organizational development perspective for building a data-driven culture, yet also, I would say, provide a springboard for more advanced analytics and increasing data literacy within a healthcare organization.
Welcome to the Health Pilots podcast, presented by the Center for Care Innovations. This podcast is about strengthening the health and well-being of historically underinvested communities. Every episode offers new ideas and practical advice that you can apply today.
Is your organization drowning in data and no one is quite sure what to do with it, and even less sure about its quality? Do you find you're spending more and more on tech systems, yet still don't have the information you need? Help is on the way. I'm Laura Blumenthal from CCI. Today, we're celebrating the launch of CCI's newest online class, Building a Data-Driven Culture. I'm here with Kushinnka and Jerry Lassa, who have worked with CCI for many years and encapsulated their best content from years teaching data governance and CCI programs into a short course. We'll spend time getting to know Essa and Jerry, understanding what data governance is, and share some concepts from the course to get folks' feet wet. So without further ado, Essa and Jerry, thank you for joining us today. We'd love to hear a little bit about yourselves and your background and when you became a data-driven culture evangelist.
Thanks, Laura. Well, I'm Essa Kushinnka, and I have a 35-year career in health information technology implementation. I've worked for EHR developers, national consulting group. I started my own consulting group, so I was a principal and co-founder of Full Circle Projects. I've been a program director with CCI. And I've spent probably the last 20 plus years of those 35 years working with the amazing providers and staff that make up our community health centers and public hospital systems. So when did I become a data-driven culture evangelist? I think, I'd have to say it was about 8 years ago when I was working on a project for some funders in Southern California and also a funder in Colorado. And we were evaluating the effectiveness of their technology investments. They had been, helping community health centers invest in disease registries and population health management systems and, of course, electronic health records. And I remember specifically interviewing a pediatric nurse in Colorado who literally broke down in tears in the interview and said, we used to be number 2 in the state in up-to-date pediatric immunizations. And now I can't get my outreach reports. I don't think these statistics are reliable. And since we implemented our EHR, we seem to have less data than ever. And similarly, I heard from a QI director in LA, or actually an IT director, I think he was. And he told me that he stopped distributing QI metric reports because they were just kind of a mess. He didn't know if the system was calculating things wrong, whether the data entry was flawed, or both. And more importantly, he didn't know where to turn to find out how to diagnose that problem. And so both of these organizations took what they called a QI hiatus. And to me, it was heartbreaking. And I realized something was terribly wrong. So I think that was the first time I realized that there's a very distinct difference between the roles and responsibilities and methods for managing technology systems and the roles and responsibilities and techniques of managing data. And so I wanted to take a deeper dive.
I know somewhere in your journey, you got to meet Jerry, but Jerry, tell us a little bit about yourself.
All right. Well, great to be here as well. I'm Jerry Lassa, and I'm a quality improvement professional of over 30 years. I started my career in healthcare in quality improvement, and I'm also an adjunct statistics instructor. I've been doing that for over 20 years. I've worked at a variety of healthcare organizations, a academic medical center, and 2 community health centers, and a network of community health centers. And it was during the past 10 years where I came across CCI and SA, and we began working on our data governance work. So, and when did I become a data-driven evangelist? Many people think that us QI and data types are born that way, and always trying to get people to use the data that we're sharing with them. But I'd say for me, there was a turning point about 10 years into my time, working with data and creating dashboards and doing lots of analyses. And it was coming across a framework called the Baldrige Performance Excellence Framework, where I started training for it and began serving as an examiner for high-performing organizations. And it was there where I began separating out the data activities I was doing from the culture that surrounded the use of that data. And that's when I made a very deliberate attempt in my quality improvement practice to spend just as much time working on data culture, meaning working with leaders, managers, frontline staff on how they were using data. Spend just as much time on that as I spent analyzing data. The very first health center that I worked at is on the west side of Chicago. And it was the first health center I worked at after working at a hospital. And so I was just getting oriented to community health. We were initially serving 20,000 patients, and I was very, very deliberate about incorporating in the notion of using data or having a data-driven culture, and also providing, good reports as well. And found that it was, a lot of the techniques and tools for, aligning your data focus to strategic initiatives and specific measures of performance and spending time on, those areas of strategic importance were really, really important. And my 5 years there, we ended up doubling the number of patients that we were serving. And, and I attribute it a lot to the data-driven culture that, we practice. I won't say I did it. It's not something any one person does. It's something you build and grow over time. But that's where I saw it was just really, really important to, just balance the amount of time between data tools and data culture.
You both shared some stories about how, the kinds of problems that being data-driven can help an organization solve for. I'm curious, whether it's in growing, a clinic's patient population, or some of the things that you mentioned, say, with the immunization rates. I'm curious, how you've seen organizations use data and build a culture to advance equity.
Well, let me take a stab at that. I think, one of my favorite quotes is attributed to W. Edwards Deming, who's, I think, often called the godfather of improvement science. And the quote is, without data, you're just another person with an opinion. And so I think we think that we're doing the right things. We feel that our actions are having the desired result, but, that may not be the truth. And very often when we use data, we only use the data that would seem to support our beliefs and our desires. And therefore, it only reinforces our biases if we're, being sort of selective in the data that we use. And so we might be missing the mark and putting our efforts into things that turn out to be suboptimal solutions. And so it's not intentional, but we really need to think about the questions we want to ask and make sure, I think, that we're collecting the data to answer those questions. And so with CHCs and their focus on ensuring equity, if we really do want to ensure equity in our work, we'll need to be able to collect the right kinds of data and stratify all our clinical, well, not just clinical data, but operational data. We need to be able to slice and dice it by race and ethnicity, sexual orientation, gender identity, and so that we can really get a detailed picture of how our care delivery processes and outcomes vary by these characteristics. And then it's there in black and white. It's not just how we feel or what our intentions are. We see what's actually happening. And so while I don't have a specific example that comes to mind at the moment, I do see health centers much more attuned to this now and realizing that they need to, in some of their important metrics, they need to really get more detailed and stratify that information and be more mindful in planning their data collection efforts so that they'll be able to get the information that they need and take action that's effective.
Yeah, and I would add a term I've heard recently on a health self-management education, among a health self-management education group. A nurse educator was referring it to almost to micro-targeting, which is something, a lot of marketing professionals are familiar with, where you aim a product at a very particular audience. And she was sharing how important it was now more than ever to micro-target with her diabetic patients and hypertension patients, and that it wasn't enough anymore to just look at the usual demographics of age and gender and race, and that you had to dig even deeper and look at, in addition to the ones you mentioned, this social determinants, food insecurity, housing insecurity, transportation, and in particular, given the past year with the shift to virtual care, looking at the digital divide, and, because you need to understand all those variables in order to help your patients and get them to improve their A1C or their blood pressure management.
I know you're both experts in the field, and I couldn't think of anyone better to create a course for CCI on building data-driven culture. Can you share a little bit about what the course is, what it's based on, and who should take it?
The course is based on a program that was developed in 2014 at CCI, the Safety Net Analytics program. And the program had evolved and iterated and changed over time. It was originally sort of a year-long intensive program. It was also delivered as a 6-month program, a day-long workshop, and now certainly a series of short videos. And we've really tried to distill the fundamentals of what's needed from an organizational development perspective for building a data-driven culture, yet also, I would say, provide a springboard for more advanced analytics and increasing data literacy within a healthcare organization. And specifically a community clinic, I would say. We were really fortunate in the early development of the Safety Net Analytics program to have had input from national experts and, superstar community health centers from around the country. And so, we've been able to leverage that into this course and really tailor the curriculum specifically for community health centers.
Who are the kinds of folks that would be a good candidate for this? Because I know I was going through it and I was like, these things even apply to my work at CCI.
I think there's really something for everyone to learn in this. And I do want to emphasize that this is not sort of an online analytics course where you learn some sort of, a programming language or something. So it's not that at all. It's really geared towards those processes and tools and methods and ways of interacting with your peers that can help you to harness the power of data. And I would say most times in our work, and Jerry, I'd love your thoughts on this too. I tend to see like middle managers in an organization, regardless of what sort of functional domain they come from. But it's usually these managers that are trying to either manage up and get the attention or resources of senior leaders for more attention and resources around collecting and sharing of data. And at the same time, these managers are also trying to push the data down to line staff to, show them how data and analytics can empower them in their work. And so it's these middle folk, the glue of an organization, that they are the ones that will most likely be taking the course. But we're very mindfully put in some things for senior leaders and or, analysts, data analysts as well.
Absolutely. And I would add, or just emphasize, there's something for everyone. Senior leaders, directors, managers, medical providers, behavioral health providers, QI people, data people, IT people, finance people. We've paid a lot of attention to incorporating value-based care principles and the need to focus on the value equation with your data strategy. So yeah, there's something for everyone. And I think, it's with a bottle of wine or your favorite beverage, it's best consumed in a group and with representatives from different areas. And because really the content is aimed at a lot of different audiences so that they can all work together better to make better use of data. So certainly we hope and welcome everyone, individuals to seek it out for single use. But just to add in a few by the numbers, so it is four modules broken out into 14 lessons. And each of those lessons are somewhere in the neighborhood of 3 to 5 minutes. And Laura, you mentioned earlier that we crammed everything that we learned over the past 5 years into this session. And we've talked about how we've taken close to 50 hours of content and condensed it into, roughly an hour, no more than an hour and a half. And you also mentioned that we were experts in this area. I think we both consider ourselves students of data governance and building a data-driven culture, because really we've learned a lot from some of the leaders out in the field who really are doing great things with their data-driven culture and have been very deliberate about including some of the best organizations, health centers that have been doing great things with data and including their stories.
You've described it over the course of this conversation, but fill in the blank. You'll know that your organization has a data-driven culture when ...
When staff feel that they have high quality data when they need it to make good decisions.
So a decision-making tool, like easy to access decision-making tools. What about you, Jerry?
I say that when things feel your work feels easier because, data is there at multiple levels to help you in your work. And, that means you've got leaders in the organization using data to prioritize things so that they're not overworking people. They're aiming efforts in the right way. You've got managers using data effectively on a day-to-day basis to manage a clinic and volume and clinical quality outcomes. And you've got frontline staff who have, good guidance from their managers and leaders. And so I think something we found a common thread among organizations that are really good at using data is that the staff are happy, the managers are happy, the leaders are happy. Everyone knows it is a very, very, very transparent organization, and transparency is considered one of the highest levels of achievement in a data-driven organization, where you know what to expect, you're very tuned in. And last comment on that, I think we have found that over the past year, that those organizations who were had a very data-driven culture were able to respond very quickly and effectively to challenges in the industry like COVID. And so that's something to look forward to as well, is that you find yourself just able to navigate the ship much easier.
Can either of you name a favorite lesson from the course that you just feel like is, if folks were going to go watch one thing, it would be this?
Oh, that's a tough one. I'm thinking of it so much in terms of the content deliverer. But yeah, I think that, my favorite lesson has sort of changed over time, I think. It used to be just the data governance lessons, the early modules, or what would be contained in the early modules, because I always felt that it was really grounding, foundational, and it helped to really demystify a lot of, the jargon around data analytics or data governance in general, and just really, providing a simple approach. But lately, I've come to really like the lesson where we introduce and show how to use the data strategy worksheet, because I think it really encompasses so many of the fundamental lessons and then helps the learner to develop a specific and very practical application for some of those principles by using the data strategy worksheet. So that's my latest favorite module. And I think that people would benefit from looking at those two. There's a module that introduces the data strategy worksheet and why it's important and how to use it. And then the second video supplements that one by actually going through a sample, like a completed sample of the data strategy worksheet.
And for me, I'm the data geek, so I have to say the data literacy visual presentation module where I have crammed into 3 to 4 minutes the best data visual display techniques that I've learned over my entire career. So you can go from 0 to 90 and with your dashboards in 3 or 4 minutes.
Wow. Now I'm like, I got to go to that video because I don't think I'm that far. I'm like halfway through. I wanted folks to hear a little bit about how you're currently using the course. How are you using it in your other work, and how might other folks consider using it?
Well, I think how we would like folks to use it is to, really select a project that you're involved in. Like you can come to it and just go through the fundamentals and, all the modules, but it's much more valuable if you come to it with a project or something that you're trying to achieve. Maybe it's a new grant that you've gotten or want to reduce disparities in hypertension control across your population, or come to it with a specific thing in mind, and then it'll help you to really, I think, absorb the lessons better. And it also emphasizes a principle that we try to stress throughout the whole thing, and that is to start small. Really, don't try to boil the ocean all at once and change your entire organization overnight. So this gives you a way to start small and then show value.
And one more thing I'd add to SA's comments about making best use of the course, something that we have found with many of the health centers is the way that they've reconciled any differing opinions about where the state of data use or data culture is at. And we have a number of tools that we have teams complete so that it can put everyone on the same page about where they need to focus. And every time we found on many occasions that staff from the same health center will have wildly diverging views on where they're at with use of their data. And so this is a great way to bring people together and have them share in a very unbiased way their perspectives on state of data governance and data use, and help them, move forward into prioritizing areas that they can work on to come together.
Those types of alignment conversations are so important. It's like everyone thinks they have the same understanding of where things are, and then you put pen to paper and it's like, oh, no, like we all are interpreting this differently. So I saw that and I was like, I think it's really valuable. That's how you set the table for the course. I really want to thank SA and Jerry for joining us today in conversation. And if you are interested in exploring the course more, you can go to academy.careinnovations.org. Again, it's full of videos, worksheets, tons of things that you can use just the same day to incorporate into your work.